Hey, Dr. Cohen at Backbone. I want to take a minute and talk about one of the first home therapies that we actually have our patients start, and it's called spinal molding. What we do with this, and I'm going to give you a kind of overview, is this is our spine, right? So what we should have is these normal healthy curves to the front. If this is front, this is the spinous processes, the bones you feel on the back of the neck or the spine. So what we want to do is, the most common problem is this forward head posture, loss of curve. We want to begin by just gently stretching the curves back into place. So in order to do that, we use these specially cut, very thick foam cushions called fulcrums. And we call this spinal molding, and there's a reason why, right? The thing that holds the spine in place is going to be the ligaments. Ligaments are very strong, very thick tissues. The properties of ligaments, however, are very, very cool for what we're going to do with them. We're going to have a person sit down, so I'm going to ask Heather, our lovely assistant, if you would have a seat just on the end of the bench for me here. Heather is going to warm up her spine by simply flexing forward and backward, side to side, and then she's going to do a twist. And these are the first 3 of our 6 warm-ups that we teach in the clinic. And what she's doing is going to be, as she flexes and extends and bends that spine back and forth, the ligaments on here are going to start to soften. They're going to change from what we call a hydrogel to a hydrosol state. And that's just a fancy way of saying they get soft and they get pliable. And it's the pliability that's super important. So Heather, you want to go ahead and do a few warm-ups, and so I'm going to have you lay down here. And you can see she's kind of pushing to a little bit of the end of motion. And we always would tell her, if there's any pain with that, obviously stop before it becomes painful. We don't want to force through pain. That's one of those common misunderstood things out there is, well, I can just force through it, or no pain, no gain. And in the rehab world, in the spine world, that's not really very accurate. If you're trying to force through an activity that's causing pain, there's a good chance you're actually going to be causing further damage or injuring something else, and we certainly don't want to do that. So she's got the front to back, side to side, and then the twists. And then what that does is it softens all of these ligaments. And so then we're going to begin with what we call phase 1 spinal molding. So what we have here is the low back support. It kind of looks like a P from the side. It's a bump for the lower back, and then cervical dorsal fulcrum, or the neck fulcrum. And what's going to happen is there's a flat edge for the shoulders, there's this cutout notch for the neck, and then we have this ramp that the head is going to rest on. And I say that because it's really important that it's put in the correct direction. So, Heather, if you want to lay back here for me. There you go. And when we set this up, what I'm looking for, this neck fulcrum should be as low to the shoulders as I can get it. So if I can get my hand between the fulcrum and her shoulders, it's not in the right place. So I'm going to lift her up just a touch, bring it way down low. Now the fulcrum's right up against her shoulders. Her neck is resting in that cutout, and her head is resting on the fulcrum. This position is actually super important because right now the weight of her head is tractioning open her neck. It's stretching things open just a little bit. Very easy, very gentle. In the lower back, the fulcrum here, the bump of the P is going to be right at that last rib. So it's not going to be in the very small of the back where everybody thinks it should go. It's actually going to go a little higher than that. And it's right there. Knees are going to be up the entire time, and this should be an actually pretty comfortable position. The first few times somebody uses them, they say, man, I don't feel that great with this. But that's because you're stretching. Once the tissues begin to stretch and to get a little bit more flexibility, they begin to remodel a little bit, it actually gets very, very comfortable. This is done for the first, anywhere from 7 to 10 days. This is phase 1 spinal molding. And the thing that I hear the most from people is, Doc, I'm sleeping so much better. Like, I don't understand what's going on. I say, well, you're putting your nervous system to bed correctly. So this is one of the benefits of the spinal molding. Once she's comfortable doing spinal molding for 20 minutes at night, and this is what I would say, Heather, if you've been doing this several nights in a row now and you got 20 minutes, no problem, there's no discomfort with it, then you're ready to switch up to the lumbodorsal fulcrum, the one that, Sharon Pettibon nicknamed this guy Bubba. And Big Bubba there, go ahead and lift up for me. The reason is you can see the difference in height. I mean, that's a big step up. So what we're going to do is put this guy underneath, and it's going to hit that same spot at the rib cage. Hang on one second, not quite straight. There we go. and it's significantly higher, so it's lifting her rib cage quite a bit. So the instructions, Heather, if this is, you're going to try this the first night, and you're going to notice it's not very comfortable. You're going to handle anywhere from 1 to 5 minutes is pretty likely. When it starts to get uncomfortable, I want you to lift up your pelvis, take Big Bubba out of there, and slide this low back fulcrum in, and then you can finish your 20 minutes. It's important that the 20-minute marker is hit because the ligaments cool down and it takes 20 full minutes. So in the beginning, if this one becomes too much to tolerate, do whatever you can handle, take it out, but stay horizontal. Don't come back up under gravity for the whole 20 minutes. Once you make the switch to this Big Bubba here, you put that lumbodorsal fulcrum in, you make that same transition down to the small one if you need to. When you can do the whole 20 minutes on this, perfect. The low back support here, the small one, isn't wasted. You're going to put it in the back of your seat if you sit at a desk for a job, if you do a lot of driving for a commute, wherever you sit the most frequently, it becomes a good low back support to protect your spine in that seated position. The questions that I get asked, well, how long do I do this? Well, it's 20 minutes every night. I joke with my patients, say you only have to do it on days that end in Y. But where's the cymbals crash, right? Every day, right? Every day that you want to have a healthy spine, that you want to be taking care of things, that would be how often. It's kind of like brushing your teeth. You don't have to have a problem to do it. You just do it anyway to prevent the problem. And that's how these guys work. There are actually fulcrum exercises that we would do in addition, that we teach people when they're ready to handle that stage in their rehab, that they can progress from using them for stretching to actually using them for stretching and strengthening their core musculature and their spine. And that's it.